Okay, so this is my third video in my series overviewing my new textbook, Comprehensive Rhinoplasty, Structural and Preservation Concepts. This book is available at QMP Publishers. It's the first comprehensive textbook on structural and preservation rhinoplasty concepts. It's gotten some fantastic reviews, and I'm going through chapter by chapter of this textbook. It has 5 parts. Part 1 is Principles in Planning. Part 2 is primary structural and preservation rhinoplasty. Part 3 is revision rhinoplasty. Part 4 is special topics such as non-Caucasian rhinoplasty, grafting techniques, crooked nose, and so on. And Part 5 are several cases shown in detail, including Gunter diagrams and operative notes in terms of what we did pre and post. This book also has 4 full videos of structure and preservation rhinoplasty cases that are available to you, and videos interspersed throughout the text. So let's dive into chapter 3, which is evaluation of the rhinoplasty patient. And I thought about putting this chapter together in a way that sort of resembles the way I approach these types of patients. And basically, when you see a rhinoplasty patient, or if you are a rhinoplasty patient, if you want to understand our thought process or my thought process, the first thing is I want to understand if my patient has functional concerns or aesthetic concerns or both. You have to do evaluation of all of those things in all of your patients. And are the patient's concerns, whether they're aesthetic or functional, aligned with the anatomic findings that you see? So if a patient complains of a dorsal hump and they don't have one, well, then there's a problem. Or if they can't breathe through their nose and you see a septal deviation that corresponds to what they're saying, then that tells you that that's something you can work on. And finally, once you've identified something like that, do you as a surgeon feel confident that you can correct the issues to that patient's satisfaction? So, and that's where it gets a little bit difficult because things are very subjective, whether they're aesthetic or functional. And so I hope this chapter gives you some guidance in that regard. Now, one of the most important things, and is something that I developed out of necessity, and also for my colleagues around the world, is the Standardized Cosmesis Health Nasal Outcome Survey, which conveniently works out to be SNOS. And it is a survey which helps me understand where my patients are coming from with regards to functional, psychosocial, and aesthetic issues around the nose. And so, actually, at the time of this recording, I just got word that 2 other countries have now done full validation translation. We're almost at 20 different languages that this is being used in around the world, so it's probably the gold standard around the world now, I'm very proud to say, for evaluation, and I highly recommend it. Now, I can't do, in this short overview of the chapter, which again goes into all of this in much more detail in text, all of the things that we look for in aesthetic evaluation of the rhinoplasty patient, but there are a few key things. Sheen described these surface landmarks as shown here, the sort of diamond shape around the tip, and this line from the brow to the tip called the brow tip aesthetic line, which is really close to the dorsal aesthetic line that we call it nowadays, and the importance of that. Toriumi and Checker both published very nice works looking at tip aesthetics specifically, and these are guide posts for me and many other surgeons in terms of how we approach how to create the aesthetic nasal tip. And so evaluating these factors is very important for our patients. Again, the brow tip aesthetic line and the diamond shape around the tip are things that we look for and we try to create in an aesthetic fashion, so understanding what they look like will help guide you in terms of whether you'll need to do certain techniques or other techniques, for example, dorsal preservation, or other tip techniques to create the tip that you want. Other things you need to evaluate are nasal skin thickness, nasal tip support, and these are all things that are explained in the chapter. So there are a number of different ways for measuring tip projection that have been described, including the Good method, the Simon's method, the Crumley method. But to me, the Simon's method makes the most sense and it's easiest to do. Of course, patients' upper lips do lengthen or change length as they age, so you have to take that into consideration. Lip lifts, of course, are changing the game completely. So when you look at a patient, though, this is a really good rough way to understand how that projection looks and whether you think it's under or over projected or just about right. We, of course, look at all the other angles, the nasolabial angle, the nasofrontal angle, all those things. I'm not going to go into all that detail here in this short video. Other things that we look for are supertip break, tip defining point, infratip break, and all of this stuff is illustrated in the chapter in detail for you. Functional evaluation involves, of course, asking the patient about nasal obstruction complaints, allergy, and so on, whether there are things that need to be treated medically, whether there are things you need to treat surgically. And that functional evaluation, of course, includes a thorough intranasal exam. So understanding how to do that's very important. This is a diagram showing the internal valve angle, which is formed by the septum and the upper lateral cartilage and the anterior portion of the inferior turbinate as well. These are the turbinates, which you should know very well if you're a rhinoplasty surgeon, and if you're a layperson who's watching this, these are those fleshy things on the inside of your nose, on the sides, that warm and humidify the air. You do need them. They should not be removed completely, but they can be reduced if done judiciously, and they are important structures to understand when you're doing a functional evaluation. Lateral wall insufficiency is movement of the lateral wall with increased negative inspiratory force when you breathe through your nose. And basically, I've described it as occurring in zones 1 and zone 2 as shown here. And we treat these a little bit differently. Zone 1 typically with lateral crural strut grafts. It can also be treated with other methods. And zone 2 typically with some sort of rim graft, which is another graft that supports that lateral wall. At the same time, of course, you'll want to fix any problems with the septum and so on. But this is an important part of our evaluation, and every patient is evaluated with regards to lateral wall insufficiency in zones 1 and 2. And ultimately, when we're thinking about our functional evaluation, I think about whether there's static or dynamic collapse, or obstruction, I should say. And lateral wall insufficiency is, of course, lateral dynamic collapse, which I just described. And static movement of the nasal bone due to trauma or prior surgery is another problem that can happen laterally. And medially, septal deviations are the most common thing. Especially high septal deviations, which can impinge the nasal valve, are something that's important and you should definitely evaluate in all your patients. So that's just a brief overview of how we evaluate patients. And key points are a complete history. There are a lot of other things you need to take into account, like prior nasal surgery, allergies, treatments, nasal steroid use, intranasal drug use, all those sorts of things. Patient-reported outcome measures such as the schnoz are very important, and I think it's a very helpful tool for you if you're a rhinoplasty surgeon. It's really important to do a sort of top-down aesthetic evaluation as well as functional evaluation for your patients, fully evaluate intranasally and externally, and really understand, and I didn't really talk about this too much here, during your whole discussion with your patients, the psychosocial aspects of what they're seeking with rhinoplasty. And that's where it gets back to the last point that I made earlier, which is you have to try to decide if what they are seeking is something you can achieve. For example, if their desires are out of the range of your capability or reality, then that's really not doing them any service to take them to the operating room. It's better to counsel them and kind of describe what the limitations are of what you can do. And so this is, I think, the evaluation of the patient is an underrated aspect of rhinoplasty, and we go into it in quite a bit of detail in this chapter. Again, this book is available at QMP Publishers. I hope you enjoyed this brief overview of the chapter, and for more details, check out the book.